Okay, Fraser, this is one of your simulations. Okay, so simulation teach. So I'm going to give you a situation, an S-bar, and then I'm going to ask you to repeat it back, make sure you understand and answer any questions, and then we'll go.
Yeah.
So the situation, you're called urgently to attend a labour ward to a baby who has just been delivered. This has been an otherwise normal delivery, a term following an uneventful pregnancy. The cord has been clamped, the baby is pale, blue, floppy, and not breathing. So the recommendation is that we assess the baby and take appropriate action. Do you want to repeat that back to me?
So essentially, term baby, uncomplicated pregnancy, but I've been asked because there's concern about baby. Baby's blue, floppy, and not breathing.
Any questions before we start?
No questions.
Happy to start?
Yeah.
Okay, let's start the scenario.
Okay. I'm just going to get my resuscitator ready, switch on the clock, turn on the time.
Is that really good?
Okay, so just tell me what you're doing as we go along.
Yeah, absolutely. So I'm just going to dry and stimulate baby.
Okay.
Am I getting any response at the moment?
No, baby is fine.
Okay.
Changing the towel.
Just making sure baby stays nice and warm.
Yeah.
And I'm just going to put the airway in the neutral position.
Okay.
Just looking, what's the colour of the baby at the moment?
Okay, pale.
Okay,
Blue,
and
pale and blue, floppy.
and floppy. Okay, and no signs of.
No.
Okay.
And the heart rate.
So pick an appropriate mask. Could you pop saturation on the right hand, please? If that's
Okay,
okay.
so saturations go on, yeah. We connected the backbone mask up to the oxygen.
1, 2, 3. So I'm going to give 5 inflation breaths. 2, 3, 4, 2, 3, 5, 2, 3. Okay, so I'm just going to reassess. Okay.
Heart rate
So my heart rate is still slow at the moment.
Yeah.
Am I breathing at all?
No.
And did I see chest wall rise when
We
I?
did not see chest rise.
Okay, right, okay. So I'm just going to make sure I'm definitely in the neutral position. I'm going to repeat the same again. Could you put a call out for help if that's
Yes,
okay?
I can.
1, 2, 3, 2, 2, 3, 2, 3, thank you. 4, 2, 3, 5, 2, 3.
And once again, you could not see the chest
So
rise.
no chest wall rise, and again, just having a listen to the heart rate, has there been any change?
There's no change.
And no breathing, no change, improvement. I think what we'll do is we'll go for a two-handed technique just to see if we can manage that. So I'm just going to place the mask on.
Okay, happy?
Draw thrust, absolutely. So just 5 inflation breaths.
3, 2, 2, 3.
Anything else you would want to think about maybe at this time?
So my concern would be if I'm not getting chest wall rise, I might need to visually inspect the airway and give some
5
suction.
breaths.
Okay, do you want to try and do the suction?
Okay, so I'm going to make sure my suction's connected. And I take it I didn't see chest wall rise in that one. Okay, so I'm just inspecting the airway. Can I see anything obvious in the airway?
No obvious, but when you put that in, it suddenly goes, and there's a big clot on the end.
Okay, so we'll just repeat the same again. We'll go for a two-handed technique because we know that's going to be effective.
1,
And this time, you are now seeing chest wall
2,
rise.
3. 3, 2, 3. 4, 2, 3. And 5, 2, 3.
Okay, so I'm going to have a quick listen to my heart rate as it come up. Okay, good. Any breathing yet?
And there's some slight respiratory effort.
Okay,
and at that
any-
point, we're going to stop you there. So let's move away from the resuscitator. We'll go and sit down, and we'll go and have our learning conversation. So grab a seat there. Sam will come and join us. So we've moved away from the resuscitator. So Fraser, you look pretty comfortable through that. Was there anything which was challenging you at that point?
I think I felt in control from the start, but the thing that concerned me was I wasn't getting chest wall rise, despite following the algorithm and going to a two-person manoeuvre, which would normally, I would hope, get a response.
Okay, so that's interesting. So what were you thinking at that point? What were the options you were thinking, and what made you choose what you did?
So I was just thinking about the algorithm, and I know that if we reach a point where we're not getting effective chest wall rise and we've not got a response in heart rate, I need to start thinking a little bit more broadly. And I guess because the two-person technique wasn't working, I was then wondering whether or not there could be a potential airway obstruction.
So, thinking about maybe potential future, would you think about obstruction before moving to that next time?
So yeah, I think I'm almost inclined to jump to that, but I suppose with the NLS algorithm, it's discouraging from suctioning the airway too early because we know it can potentially make things worse. So I think there was almost a tendency to jump in sooner, but I kind of held myself back. So I don't know. I think the important thing was when we did it, we got a response.
Absolutely. And I suppose in some respects, that's why there's an algorithm, why we follow that, and we got the response, and on this occasion, the baby, everything was, you did, was fine. You managed the airway, you opened the airway, you attempted through the fight for inflation breath, and then repositioned. So from the algorithm point of view, do you have any further questions?
No, I don't think I have any questions at the moment.
So, in summary, what we've done in that scenario was we've gone through the NLS algorithm, managing the airway through the five inflation breaths, repositioning five inflation breaths, two-person technique, and then the suctioning. We've discussed the potential of suctioning earlier versus. Okay, so we're going to do some more scenarios, and it'll be your turn after some of your colleagues.
Thank you.
Thank you.